I'd like to start by acknowledging the traditional custodians of the lands and seas on which we live and work, and I'd like to pay respects to elders past and present. For those that don't know me, my name is Kayla and I work with NQPHN based in Mackay. Also joining us online today from the MARTA research team, we have Dr. Jenny Job and Ruby Strauss. From PHN side of things, we've also got Jenny Burnham, who is our Primary Care Engagement Manager online, and we've got Tara Evans also online, who is our Primary Care Workforce Manager. Ruby is going to start us off today by giving us a little bit of an overview of the VIP program.
My name is Ruby. I'm from the Centre for Health System Reform and Integration, and we've got Jenny, the Research Director, online as well. So we're just going to be talking a bit about the Virtual Integrated Practice Program. As Kayla said, please post questions in the chat as we go, because I can change the content of the presentation according to what questions come through. But we will have time for some questions at the end. So just a bit of a background of the program today, explaining the program details and what's involved from practices participating in the program, learnings from our current practices that are involved in the program, and again, lots of time for questions at the end. So this is really catered towards the practices who are thinking about participating, who are suffering with workforce shortage of GPs. So that's practices that are in MM4 to 7 regions. So this program was really born out of a need to address critical workforce shortages of GPs in regional and rural Queensland. Obviously, there's a lot of practices really struggling, and they've been struggling for a long time. And as a result, many are having to close down. It's not viable to continue. So our team is partnered with a number of PHNs, Health Workforce Queensland, Southwest HHS, to develop a strategy to try and address these issues. So these are our goals, and they're aligned with the quadruple aim, which is now the quintuple aim. So really trying to increase the workforce in rural and remote areas, improve workforce retention, improve the provider and practice experience, so that's the practice staff. From a patient side of things, try and improve access to primary care and deliver safe and high quality GP care to improve the patient experience overall. And then from a system side of things, have a cost efficient model in place, all the while reducing ED attendance and preventing hospitalisations. So this Virtual Integrated Practice Partnership Program was co-created. So that's with the Primary Health Networks, Health Workforce Queensland, and along with the general practices. So really a bit of a partnership, and everyone put their heads together to think about what sort of strategy or approach would work best to address this issue. So to do this, first we started with a rapid review of the international literature, just to have a look at what other programs were out there. What we found is that there really wasn't much published in the literature about a model of care that involved GPs working off-site to virtually support rural practices in Australia. So there were no research publications in Australia that used that sort of model. Stakeholder development of the proof of concept, so that the practices in these areas that were involved in the co-creation of the program really highlighted the needs that they were looking for, and that was some sort of virtual support for times when there was big influx of patients and they didn't have enough GPs on the ground to support the practice. And there were a few other aspects identified that were needed to facilitate the program, and a big one for that was the continuity of care. So having a system where a different GP is working in the practice each week wasn't going to offer that continuity of care compared to a model where you've got the same GP working every week. So that led to the development of the proof of concept program in Western Queensland. So we had one rural practice in Western Queensland who were involved in the co-creation, and they recruited a previous locum who was then living in an urban area to work virtually with the practice 1 day a week, and that was in 2021. And then that expanded to 2 more practices in one in Western Queensland and one in Darling Downs in 2022 and 2023. So all the while we've been collecting data addressing those quadruple aim outcomes of patient experience, provider experience, costs, population health, to inform the expansion of the VIP partnership program. So I'll explain the program in a bit more detail now. So in a nutshell, the program involves a GP from an urban area. So usually the GPs that we've got in the program live in Brisbane or the Sunshine Coast or the Gold Coast, and they become matched with a rural or remote practice in Queensland, and they become part of the practice team. So as I said, having a different GP every week doesn't really offer that continuity of care. So by pairing one GP with one practice, you're getting that continuity of care. So it starts with an in-person visit, so 3 to 5 days on the ground at the practice to build a relationship with the practice staff and to build a relationship with some of the patients at the practice. So when they're there, they're consulting, and they can get an idea of what resources and referral options are available. And then following that, they start the virtual appointments. So they return home to Brisbane, Sunshine Coast, Gold Coast, wherever they're based, and provide remote consults 1 day a week via telehealth. Usually that's video health. And the number of days that they work with the practice just depends on what works best for you and for them. So if that's 1 day a week, whether that's half day a week, 1.5 days a week. So the GPs in the program are contracted at $200 an hour rather than a percentage of billings. So that's based on locum rates. So they earn that amount when they're there on the practice at the practice in person and when they're doing the virtual telehealth. And then the practice bills as per usual, however you'd like to bill, and you keep 100% of those billings. So patients tend to attend their appointments in person at the practice. So that's really important to sort of have that support from the practice team on the ground, whether that be the practice nurse, if any obs are required. And also it just makes it easier when it comes to billings and getting the person set up with the telehealth appointment is easier if the patient is in the practice in person. You don't have as many technical difficulties and you're not relying on their home internet for video health. And then as a result, the GPs based in the practice are a bit more freed up to see patients who require physical examination. The recruitment of the GPs, we've got a list of GP candidates, VIP GP candidates. We have their CVs, so if any practices are interested in the program, we'll meet with you first just to get an idea of what your needs are, what sort of GP you're looking for, how many days a week, and we'll have a look at our candidates and see if we can find someone who might fit. We'll send you any CVs of anyone who could be a potential VIP GP for your practice. Then we'd set up a meeting by Zoom or Teams just so you can interview each other and see whether it is a good fit. Assuming that it is, we'd arrange that first face-to-face visit for the new GP to come visit the practice. And then the GP after that provides telehealth 1 to 2 days a week ongoing. So that is then followed by another face-to-face visit every 6 months. So the GP comes back every 6 months and spends time in the practice. So we are recruiting more practices to be involved in the program. We are looking for practices in those MM4 to 7 areas. You do need to have a high level of digital literacy, including video health connectivity. So we've found that a lot of practices have had a lot of experience with this after COVID and have telehealth systems in place already for specialist appointments and that sort of thing. And the practice needs to have organisational structures in place to support the pilot study. Another thing is just having a practice champion. You really need the support of all of the practice staff to deliver the program, the practice manager, the practice nurse, the GPs on site. There is a data collection aspect, given that this is an ongoing research evaluation. So there is data collection of billing, so item numbers, any costs for implementing the program. From a practical point of view, you need to have a room available so that patients can come in person to see the virtual GP, so having a room available. And in that room, you obviously need a laptop, a computer, a webcam, microphone, and a reliable internet connection so that you can run those telehealth appointments. So this here is Sam. He's our VIP GP based in Ingham. You can see there he's visiting the Ingham Family Medical Practice team. That's his second visit there. And then on the side, he's doing his telehealth. So Sam's based in Brisbane. This practice in Ingham just had a huge wait list, and the GPs just weren't able to see all of the patients. They'd been struggling with GP recruitment and retention for some time. And by involving a VIP GP, it just took the pressure off, and they can actually see the patients who are calling up that need an appointment. So again, please flick through any questions. We'll be wrapping up the slides soon. So if you've got any thoughts, do let us know. This is the learnings from our current practices involved in the program. So this data that we're collecting, most of the appointments have been via video health. Most patients, as I said, attend the practice in person for their appointments. And a lot of the consults have been repeat patient encounters. So we are finding that the GPs, although they're based remotely, are able to build rapport with patients, and the patients are rebooking to see that GP and can sort of provide that continuity of care for the patients in the practice, opposed to, maybe a locum situation or another sort of telehealth service where you might not be getting that continuity of care. You do need a practice nurse who can provide support for the virtual consults. And it is definitely helpful if there's another GP on the ground, should the patient really need that physical examination from another GP. The costs vary. So for the travel of the GPs out to the practice, we are getting some support from Health Workforce Queensland. So the travel costs associated with that, so flights and accommodation of that visiting GP, are covered by Health Workforce Queensland. And the cost for setting up the virtual model, it varies, but we do find that a lot of practices are already set up for telehealth and they have the equipment required. So it's often used for things like chronic disease management, mental health appointments, early antenatal visits. This works really well. Shorter appointments, so 3 15-minute appointments, seems to work really well for most of the practices involved in the program. It's very important that the practice staff have an idea about what an appropriate telehealth patient looks like. So someone who's hard of hearing, someone that's got a complaint that might need to be seen by an on-the-ground GP. So the triaging process is very important, and someone to get the patients in the room and feeling comfortable. Marketing. So it's also helpful if you can let the patients in the practice know that you've got this service starting up. So if you've got a Facebook page, we found that works really well. So the patient feedback's been really good. I'm just going to run through this quickly so we've got some time for questions. You know, the patients have had some really good feedback and they'd use the service again. It improves their access to primary care, and they're really happy for something like a quick script that they can just see the telehealth GP and sometimes not even come into the practice if it's something quite easy. So I might wrap it up there and pass back over to Kayla just to see if we've got any questions in the chat.
There is one question in the chat, Ruby, from Tully Medical Centre, which is based in the Cairns and Hinterland region. So what has been the experience from the financial perspective? By the time you allocate a room and a nurse and pay the doctor's fees and the locum fees for travel, housing, car, etc., it is hard to see it's viable. How long can we rely on Health Workforce Queensland funding? Is this a long-term commitment?
Yeah, that's a really good question. What we're finding is that the practice billings are covering the salary of the VIP GP, so it's really tends to be a cost neutral exercise. Health Workforce Queensland have been good and have been paying for all the travel and accommodation for the VIP GP visits every 6 months. And they're committed to doing that as well. There is also some funding which Kayla might like to talk about from the PHN to get the program going. What we're finding is it probably takes about a month to get the program established, you know, get patients happy to book in with the VIP GP. You know, some are great, some will do it straight up. The bookings aren't full for those first few weeks, and then they tend to fill up. And I think what they found at Ingham is they've actually now got Sam there maybe a day and a half a week, and he's working across 2 practices, so Ingham and Cardwell. And it really, the benefit is it's taking the pressure off the rest of the practice. You know, and the patients don't have those 3-week wait times, just meaning that there's a lot less stress for the admin staff, and everything, you know, feels a lot calmer in the practice.
Yeah, so additionally, PHN are also offering practices participating in this program a payment of $20,000 initially, which will just help assist in those initial setup costs. Are there any other questions?
I guess following on from that, Carla, some of the practices might be using that to fund the nurse time. Some of them are using it for maybe upgrading a computer, make sure. All you really need in the practice and the VIP GP is a computer with a good camera and speaker and microphone. That seems to be working really well with all the practices we've got involved.
Did you have someone online typing? I've also just thrown our expression of interest link in the chat. So any practices that are interested in the program can submit an EOI via that link. Andrew, are Aboriginal Health Services eligible to participate? I believe so, Jenny.
Yeah, that's right. And we've actually in discussion with a couple of practices out in Western Queensland, one who can see that it would work really well, where there's an Aboriginal health worker who might be able to support with the health assessments, and really, because they're way behind with those, using this service to do those health assessments with the support of the Aboriginal health worker. They've got quite a few in the practice. So Yeah, I think that's a great use of the VIP service, Andrew.
Thanks, Jenny. Thanks, Ruby. If there's no other questions, we might wrap it up there, but obviously you can get in touch with myself, Jenny or Ruby to assist, and we're more than happy to arrange a meeting offline to discuss further as well. Thank you all very much.
Thanks, Kayla.
Thanks, Kayla. Thanks, everyone, for